Hi everyone, I'm here with Dr. Shazar Hameed, a consultant orthopedic surgeon and a member of the Orthopedic Association Sri Lanka. So we are here to educate the public regarding scoliosis and spread awareness of the Scoliosis Awareness Walk. Hi Dr. Hameed, how are you doing today?
Hi, thank you very much. I'm fine.
Can you educate our viewers regarding scoliosis?
Yes, scoliosis is a condition which affects the spine of especially young individuals. It is it's predominantly seen in the age group of around 10 to 16, but you also see this in very young age group as well. So this is a condition which causes your spine to sort of curve in a very S-shaped manner, making it a bit unsightly, and which tends to progress, causing physical and psychological problems to the children as young adults and their families as well.
How can the early detection and management change the outcome?
Yeah, so one of the main reasons why we thought of educating the public regarding the scoliosis is to enlighten people and the community regarding the problem, the fact that scoliosis does exist. It is not so uncommon as we expected, and how to detect it early and how to guide them to proper places in order to get treatment at a very early stage. Currently we see a lot of people in the public are quite not aware of the situation, and hence they approach medical assistance at a very late stage. As we know, as like any condition, if you do address scoliosis at a very early stage, you can avoid them going into serious repercussions. Especially, you might have heard that there are like advanced surgeries provided to correct scoliosis surgery. Technically, the number of children who are subjected to surgery are very low percentage. But unfortunately, especially in a country like ours, because of lack of awareness, we see a lot of kids approaching us at a very latter part of the disease conditions requiring surgery. So what we are trying to do is to make people aware about the condition, to detect them early so that they approach the services provided by the orthopedic surgeons who are scattered along the entire country, who can detect this condition and, if required, direct them to places where their expert opinion, expertise are available, where they can have this condition resolved.
Yeah. Can you tell us about the Scoliosis Awareness Walk that is happening on the 23rd of June?
So Scoliosis Day is actually a day which is sort of celebrated, or rather conducted in elsewhere in the world. It is usually the last Saturday of June every year. So coinciding with that, we plan to organize a walk on the 23rd of June this year. So that will be the culmination of all the preparations we do throughout for these weeks. So we are having quite a number of events which we are conducting parallel to that. Especially, we will be conducting quite a few interviews like this to make public aware about it. And we also have ways and means to educate, especially kids at schools, through schools all over the country, and to make children and their parents aware about the condition. So we have prepared informative brochures which we are going to distribute to students, hopefully to the entire country. And we also, the walk in itself is targeted to again get public attention and the media attention so that people are aware about this. So it will be conducted on the 23rd of June. So we are hoping to initiate the walk from the Lady Ridgeway Hospital in Colombo. So Lady Ridgeway Hospital being the hub of scoliosis surgeries in the country at the moment, along with the National Hospital of Sri Lanka, because vast majority of this is affected by kids, so kids surgeries happen quite often in LRH. So we are going to initiate the walk on the 23rd at the Lady Ridgeway Hospital. have a short walk along Colombo streets, and we'll be approaching, the walk will terminate at the Independence Avenue at the College of Surgeons. So along this way, we hope all of you, including you all, will join us and help create awareness among people.
How has the local businesses and the community responded so far?
So from a community point of view, I think especially the staff at the hospitals who are related to scoliosis management in patients and not, have been quite supportive, and they've helped us to sort of create awareness through this program quite a lot, and then they will, I'm sure, participate in large numbers for this walk as well. From a business point of view, I think we've getting a lot of support from the industry as well, who are willing to help us with no sort of hidden ambition, but just just in a very with the sole motive of trying to help these children. So we're still at the sort of the preliminary stages of it. So we hope to get more support from the community and the businesses around as well.
I also mind if me asking you, what are the facilities, technology that is available in Sri Lanka, because people put themselves in debt sometimes to seek international help?
So what's happening is it's one of the I think the reasons why we wanted to educate the public as well. I think we notice elsewhere that there is a sort of an organized group of people who are trying to convince these innocent kids and their parents that this is a condition which has dire consequences and they need urgent intervention. Well, you put yourself into those parents' shoes, and then you would, if your kid is affected and if you come to know of such situation, you would be in a situation where you would sort of risk anything to get emergency help for these patients. So what we realize is it's all due to lack of awareness. Firstly, we have in this country a structure, as you correctly mentioned, I'm a part of the Sri Lanka Orthopaedic Association, which is a collection of orthopedic surgeons who are scattered all over the country. So we basically cover virtually every district in this country. So every orthopedic surgeon in this country, starting from Jaffna to down south, would be able to detect at a very early stage and to manage the early stages of scoliosis. And if they do require any form of surgery, to direct them to places where these surgeries happen. So there are stations in Sri Lanka who provide these advanced surgeries as well. At the preliminary stage, actually, they don't need surgeries. So it's all about trying to detect them early and to prevent the progression of this deformity or the bend. So that can be actually controlled by, we'll speak about it in further as well, sort of a brace which you wear, sort of a tight costume which you wear, like it's like a veil costume which you wear to your body, which will control the progression of the curve. So, and that could be sort of done in any parts of the country by an orthopedic surgeon. So this Sri Lanka Orthopaedic Association has a large membership who all provide this service. And if by chance some of them go to stages with a significantly large curve and they need surgery, we could provide them surgery. So there are in the state sector quite a few stations who provide these advanced surgeries, namely the National Hospital of Sri Lanka, the Lady Ridgeway Hospital for Children in Borella, the teaching hospital at Jaffna, and the teaching hospital of Badula where I work. So we all provide these advanced surgeries. From a resource point of view, yes, there are constraints, but well, there are constraints anywhere. Yeah, so, but like we still manage to provide these facilities to kids, despite this being quite an advanced surgery. And the facilities where we are working have been quite helpful to us to continue this as a continuous process. And there would be a bit of a wait for these patients to get these surgeries done. Well, you have a wait anywhere in the world. Even if you go to the West, there will be roughly about a year and a half waiting list for these patients. But like the important thing is the public, especially the kids and their families, are aware about what could be done and what's the consequences of their disease and where to go. So this is the most important thing.
And what strategies are being used, obviously, with the awareness walk happening, to aware the public regarding scoliosis and to also reduce the social stigmas?
Yes, so again, another important question, the social stigma. So what we've noticed is, unfortunately, most of the kids who are getting affected are young girls, we notice, so they're quite worried about their appearance. And obviously, if they are affected, what they are going to feel is whether this is going to become worse.
Yes.
Obviously, there is a significant risk of it progressing. And if they are diagnosed with this condition, whether they will be sort of cornered in the society. And there are so many stigmas, and especially like when it comes to this nomenclature in Sinhalese, we used to call it with names which may be quite sort of harmful to them and which cause them a lot of pain. So we've avoided certain words, and we keep on calling scoliosis rather than any other words for them as well. So what we are trying to make them aware is that despite having scoliosis, you can have a normal lifespan. You can do your normal day-to-day activities. You can still become a normal individual, a normal adult with absolutely no consequences. So we are trying to, so all what is required is for you to know what exactly to be done for these conditions, and that is what we are trying to achieve with this.
Is it 100% curable, just putting it in public?
Yes, it is. Yes, it is. Provided that, so what we mean curable is, so as we said, the most important thing with scoliosis is how bad is it going to become. So scoliosis can happen due to numerous causes. So the vast majority of scoliosis which we see in our normal practice, which happens in this classic age group of around 10 to 16, which you call the adolescent period, unfortunately no cause identified. So this is the classic group who, with the onset of their sort of growth spurt, they notice that they've got a issue in their back. Quite often it's not them, or somebody has seen them having an abnormality, and they sort of get our opinion.
Being insecure.
Exactly. So if it is detected quite early, so how bad a scoliosis and how worse it will become depends on first is how much of growth potential a kid has. As you know, kids, especially boys and girls, both grow in a very rapid phase when they are adolescent period. And the other factor is how bad is your bend or the curve. So there are means of sort of assessing and quantifying the curve. We can do x-rays and we can measure the curves and say how bad they are. And based on that, as we know, these kids grow until about the age of about 16, 17, 18, depend on whether you're a girl or a boy. So as long as we can control the curve to a sort of a manageable figure, we can sort of control it with in a non-operative way, without any surgeries, with a sort of a brace that I mentioned you, until they've finished growing, and then we can quite confidently say you don't need any other treatment.
Yes.
So it's only a small percentage, despite our best efforts, or sometimes because they present to us quite late, would end up requiring surgery. So even if there is surgeries, we can provide surgery in this country. As I told you, there are quite a few centers which provide surgery. So we can provide surgery to prevent it becoming caught unsightly and correct the shape to a certain extent to make them feel comfortable. And also there is a myth among the community, especially kids' parents, who think that scoliosis is caused by lifting school bags. It's not true. So as we know for a fact that it is not a cause. There are vast majority of scoliosis, as I mentioned, there's no cause identified. But lifting school bags is not a cause. So these are the kind of myths that we have to deal with and make public aware that the real reasons and real situation regarding scoliosis.
And also, what are the future goals of the Sri Lanka Orthopaedic Association with the Sri Lanka Spine Society?
Yeah, so as you brought up the word Sri Lanka Spine Society is like the sub-association under the mother organization, which is the Sri Lanka Orthopaedic Association. So Sri Lanka Orthopaedic Association has a large number of, at the moment, trained doctors who are keen on addressing spine issues, scoliosis being one of them. And we have quite a number of surgeons with such skills who are trained here and overseas and who are posted in various parts of the country. So they all are equipped with knowledge and skills to provide these services. So Sri Lanka Orthopaedic Association is, again, it's not a trade union, it's a sort of a college of experts who provide expertise to the community, and also it works hand in hand with the health ministry in providing expertise and knowledge to sort of uplift the standard of care in this country. So what we are hoping to do is to expand where we can provide these services in the country. As I told you, there are so many doctors who are well equipped with knowledge and skills to provide this service elsewhere in the country, which does not still have the resources to carry out these kind of big services. So we are trying to liaise with the government and hopefully to expand the services so that these kids can get these services from a very close place to where they live.
A trustworthy place, because getting the service from your mother country is way more guaranteed than going to an international.
That's true. So as I told you, there is a big issue going on with this regard, where these kids are being dragged to overseas countries, and they have to pay exorbitant sums to get these surgeries done. And as we know, with the country who are sort of quite recovering still from a financial crisis, this may be affecting them a lot. And on the other hand, these surgeries, especially done in overseas, not just overseas, even in our country, require constant follow-up. So, which means that there may be complications. The complications related to surgery are not uncommon for any part of the world. It may happen here in Sri Lanka, it may happen even in overseas. So these patients need constant observation, follow-up. And what we have noticed is most of these kids who have had their surgeries done overseas do lack follow-up post. So that is becoming an issue. So, so providing surgery is only one part of the treatment. So you need constant follow-up. So that becomes quite convenient for them if they are followed up with this. It does not mean that we don't provide them service, but like we do take care of our kids. There are populations, so we do take care of them. But like they are in a huge a problem when they cannot have services after their surgery, unfortunately.
We're at the end of our conversation. Any message to the public to join the walk?
Yes, so hopefully we are trying to conduct the walk as we plan on the 23rd of June. So it will start at 7:30 from Lady Ridgeway Hospital. So what we hope from the public is if you're living in the vicinity, come and take part in our walk. And this will help us, the walk itself will help us, give us an opportunity to know about scoliosis, and that will help us to spread the word to people we know, and perhaps like people might be knowing people who are connected to them who are having scoliosis and who are not aware of it. So that way to sort of convey the message to the whole public, the fact that early detection of scoliosis helps to prevent any serious issues, and also if they do need treatment, as a country, and the services provided this country are far more adequate, and they do not need to seek help from overseas, and we can provide them that services.
Let's join together for the Scoliosis Awareness Walk, which will commence at 7 a.m. from the Lady Ridgeway Hospital at the 23rd of June, which is also the Scoliosis Awareness Week. Dr. Hameed, thank you for joining with us today.
Thank you very much. Thank you.